Hello, everyone. I'm Lisa here with Thrive, and thank you for watching the Thrive Ahead YouTube channel. Today, our topic is rehab following a hip replacement. So here with us today, I have Jignasha, our therapy director at one of our Thrive centers. Thank you, Jignasha, for joining us. And we're going to discuss and give you some helpful tips on what to do after your hip replacement surgery. And what does the rehab experience look like? What to expect? What questions you should ask. Let's say if you're looking before this starts, if you know you're having surgery coming up, finding the right rehab facility, what you have to do. So first, we're going to discuss the actual surgical process, okay? You were admitted into the hospital, you're ready for surgery. Now you've had your hip replacement done. What typically happens next? So from our experience, within the first probably 3 to 4 days, you're going to be in the hospital, and then the hospital is going to prepare for your discharge. And during that time, they're going to ask you, where are you going to go for rehab? And it's up to you to obviously make that decision, or you could have this in advance, or if you're making that decision while you're in the hospital, we suggest probably doing it, further in advance or with further notice. And you can then tell them, here's where I'm going. And then once that decision is made, the hospital is going to coordinate transportation from the hospital to the skilled nursing facility. And that's where we come in. So we're going to talk all about that admission process and what it entails. So once you physically arrive to our center, you're completely acclimated to what's happening here at the skilled nursing facility. And that includes engaging with our nursing staff and our CNA staff. But really, Jignasha is going to talk about specifically the therapy process and what that looks like. So Jignasha, I'm going to pass it over to you. If you can tell us a little bit about, once you're first entering into rehab, what does that look like from a therapy perspective?
So when the patient arrives at our center, like you said, the nursing staff is going to acclimate them, make sure they're situated. We want to make sure that their pain is managed, and that's a front-running thing that we want to make sure they're ready for their evaluations. Within the 24 hours, we are already evaluating them. It does not matter if they arrive on a weekend, which is typical. We have therapy staff here, which is all in-house at our center at Thrive. And we do evaluations all the time. So within 24 hours, the patient can expect to be evaluated by physical therapy, occupational therapy. We also have speech therapy here. If there's a need for speech therapy, they're also evaluated. So from a physical therapy standpoint, they're going to be evaluated on their gross function. We want to making sure that they can get in and out of bed. They can be able to stand and sit, to transfer from one location to another, to work on that walking, being able to get up and down the stairs, improve their balance, improve their range of motion in the hip, making sure they're following their precautions. All these things are included within physical therapy. Occupational therapy grossly works on daily occupations. So the things that they need to do to succeed at home, whether it's light meal preps, do they need to get themselves ready for the day? Do they need to how much help do they have to do dressing, grooming, bathing, hygiene management? If they were doing it all independently, we want to make sure that we're working towards those goals of independence for them to succeed at home. The sessions of the therapy are roughly 1 hour for physical therapy, 1 hour for occupational therapy, 7 days a week. And then, like I said, speech therapy as needed as well.
How does the hospital communicate to the therapy team? You had mentioned precautions, so I think that's something we should really discuss. How is that communicated to the skilled nursing facility? I think we obviously know how that happens inside, but for our patients watching now, how does that process work? How does their orthopedic surgeon appropriately communicate what's needed following that surgery and ensuring that it's followed at the skilled nursing facility? So what do you typically do? How does that communication work?
We have a large series of orders that come through from the hospital to us. So we're reviewing all of the orders and guidelines that are sent to us from the orthopedic doctor, as well as other doctors from the hospital. So the clinical team is taking that, breaking it down, and making sure we have taken all of the information to make sure we're providing the best and most optimal care for the patient based on the orthopedic orders.
Okay. And what is the typical process for following up with their orthopedic surgeon? How often does the skilled nursing facility communicate with the orthopedic surgeon? And then, as we'll talk about later, when they're ready to go home, what does that look like from a communication standpoint?
Great question, Lisa. So one of the biggest things for our orthopedic patients is that follow-up ortho appointment with the doctor, because a lot of the times their weight-bearing status is partial weight bearing, non-weight bearing. And we're waiting for that orthopedic appointment to upgrade them to the next level, really help them get to the weight bearing status and to the independence that they need to succeed at home. So as soon as they come in and we have those series of orders that I talked about, a few of those orders are going to be when to follow up, 2 weeks, 3 weeks from that surgery date. And we have specific staff here that just make appointments for those patients. So their job is to make the appointments, and so we don't miss out on those crucial appointments. They make those appointments early on. They contact the patient and or the family members to say, this is what, when the appointment is, we can provide transportation and set that up, or would you like to take them? Therapy has a big involvement in that, because we want to get them to succeed in car transfers for going home, but also car transfer training to be able to get to things like these appointments. So when we know their appointment's coming up, that staff member that's making the appointment will coordinate with therapy to say, hey, the appointment is next Thursday. Do you think that they can go in a family car? Can you practice that? Make sure that they're going to be able to succeed. We will say yes or no, depending on how they're doing, and we'll help them be able to get to that appointment.
Okay, great. What do you suggest as far as like a typical length of stay for a hip replacement patient? I know that's a very common question asked by potential patients before they come to a Thrive center, especially. So what do you recommend as far as a length of stay? What have you seen on average as far as how long people spend in rehab?
It's a very variable answer. It can be as short as 7 days, but it can be 21 days. So about 14 to 21 days is on average what we see, depending on, if it's a planned routine surgery or if it was an unplanned surgery. We really want to make sure that we are managing their pain so that at home they're able to succeed, and we're weaning off that pain medication as much as possible also.
Okay. Thank you. How often are you communicating with the patient towards their goal for going home? Obviously, you said they're receiving, you could receive up to 7 days a week of therapy. Could that necessarily be less time as well, as sometimes they're doing maybe 5 to 6 days of, therapy a week? How do you work with the patient and their family, if the family's involved, to prepare them for going home? Like, how often are you touching base? How does that look like when it's more of like a bigger picture? How do they know if they're succeeding, I guess, is really the question.
Yeah. Great question. So we are talking to the patient on a daily basis, because we really are reevaluating on a daily basis, because we're such a short-term rehab. We are going through their goals on a daily basis, our expectations for what we want the patient to do. All outside of therapy is discussed daily. We want them to be able to walk to our restaurant for breakfast, lunch, and dinner, so that they're routinely walking, getting into the habit of doing things that they need to do at home. And then we incorporate the family pretty early on, because we want to know what the home setting is like. Oftentimes we ask them to send pictures or videos of what the home is designed like, so we can simulate that same situation in our center. When we are getting towards discharge, we call the family to set up car transfer training, caregiver training. We also complete home evaluations as needed, so we can also go to the patient's home and complete evaluations to really ensure that discharge is safe and successful.
Wonderful. Okay, so here's my biggest question, which we often receive sometimes, and that is, how do you know if you're going along the right track? So if you are let's say you end up rehabbing at a skilled nursing facility, and let's say that you don't start therapy right away. And sometimes we will actually field inquiries from families and patients that they're at another facility and they may not be having the best experience. How do you know when the experience isn't going well? How do you know when is the right time to maybe think about transferring to another facility? How do you know to get to that point? And if you do get to that point, or if you're thinking about it, who should you communicate with in that other building, with the other skilled nursing facility? And what questions should you be asking? So I want to be able to make sure that for the viewers watching today, that they have all the resources they need, because that sometimes does occur. So if things don't go according to plan, how do you recommend they handle that? And how do they know if it's not going according to plan?
Sure. So really, if you're not getting your evaluation and you're not getting that therapy started early on, it's really something to question. As research has shown, having early therapy right after surgery is so crucial. So if you're going into a skilled rehab center and you're not having an evaluation early on, right as you get in there, and you're not having your treatment, is something to discuss with the staff there, the therapy staff. You want to be able to see that your pain is decreasing, that you're able to, increase your function almost on a daily basis, and if that's not happening, that's something to question for sure.
Who should you speak with directly? Like, is it the therapist themselves? Is it the director like yourself? And what is the time frame then for an evaluation or the initial start of therapy? So you mentioned we do one within 24 hours. Is 48 acceptable? Is 72 acceptable? When does it become too late to where, why are they seen yet? So I guess that's the question I have too.
Yeah, so we do our evaluations within 24 hours. So to me, anything outside of 24 hours is really, too far gone, because you're at a center purely for that reason. And if you're not getting that care that you're going there for, then you're not really meeting your expectations.
So as far as just next steps of it, just for our viewers listening, if, obviously we hope you have a wonderful experience no matter where you go. Obviously at Thrive, we'd like to get therapy started immediately. But if you do seek additional support, if you feel that your needs are not met, you could always report to that director of therapy at that building, whoever's in charge of the rehab director, not just the therapists themselves. Obviously you want to start there. But if it's not going where you need to, you can always take it to that step. And then if you felt that was not addressed, we always suggest reaching out to the administrator of the building, because they really are the leader, and if they can field any questions, concerns, or things like that. So that would be our recommendation if you end up experiencing that at another skilled nursing facility. Another question I have is, what is the discharge home like then? So I know we talked a little bit about it and preparing them for going home, but let's say today's the day you're going home. What does that look like from a therapy perspective? How do you know that they've achieved, most of their goals? And, can you kind of break that down for us? What does that look like? Maybe the last 24 hours.
So we have a discharge checklist that we use for our patients, and we really utilize it to make sure that we are not missing an area that's going to cause a patient to not succeed at home. So we go through each area for each patient to say, okay, if this patient is meeting all these needs that they have for home, then they are ready to go home. Are they able to walk the distances they need to? Are they able to do it independently? Are they able to get themselves ready for the day independently? Are they able to get up and down their stairs that they need to independently? Because, they are going to go home. Home health is going to come in. Are they going to be able to get down those steps to open the door for them? Are they going to be able to succeed at home independently? Are they going to be able to get up in the morning and make themselves breakfast? Are they going to be able to go to the bathroom on their own and be safe in doing so? And we want to make sure that we are communicating with the social service team to make sure they have the equipment that they need to succeed at home as well. So that's part of the discharge planning, determining what equipment they need at home, talking to the family and saying this is the equipment they need. Social services determining how much of that can be provided from insurance, or where can the family find it. So providing the resources for them. If they need caregivers, providing them the information, making sure that they've reached out, they have the caregivers ready in place. If those caregivers are hired, we are going to make sure that we bring in the caregivers to our centers, provide the caregiver training, so that when they go home, they are ready to go and they can get to the next level of care with their home health services.
Wonderful. Okay, great. Another question I have is, when you're preparing, we're going to go back to the beginning here when it comes to making that decision on where to go to rehab. If they have the opportunity to ask questions related to therapy, what do you think are some of the key questions that a patient or their family member should ask as they're researching their options for rehab? What do you think are the best questions related to having a hip replacement and for, the physical therapy and the occupational therapy piece?
Yeah, so great questions to ask would be how often the patient would be receiving therapy, how long the therapy sessions would be, how soon the therapist would be, or how soon the patient would be evaluated for therapy, and what does their discharge planning look like? Are they going to be able to provide everything that the patient needs to be able to succeed at home?
Is there really a key difference between in-house therapy teams and outsourced therapy services? What do you notice as far as key differences? And, obviously here at Thrive, we have all in-house therapists, but what's the difference between the two and why is that such a crucial question?
Yeah, so here at Thrive, we are in-house and it is a big difference. So in-house, the therapy department is also employed by the same company as the rest of the team. And it is a big difference because we are all working together. Our goals and everything are together. So we are here to help one another. We don't have to go through different loopholes where it's one person's job or we have to go through someone to get something done. It's all together. So it makes a big difference in the way the feel is. It's all connected in the goals and they're there to help each other. It's just a big difference.
Well, we really appreciate you being available for us today. And thank you everyone for watching the Thrive Ahead YouTube channel. We want to continue providing conversations like this, and we hope you find it very helpful. And if you have any questions, you can feel to reach out. You can comment in the comments section, or you can reach out to us at www.thriveahead.com. So thank you again and have a great day.